Time to attend today or tonight, depending on what time zone you are in. My name is Professor Darryl Higgins. I'm Director of the Institute of Child Protection Studies at Australian Catholic University. And as is customary in Australia, I'd like to begin by formally acknowledging the Indigenous peoples of Australia, the traditional custodians of the land that I'm coming from, and pay respects to elders past, present, and emerging, and acknowledge their connection to land. And we're very pleased to present this webinar today, supported by the Global Safeguarding Alliance. It's a group formed in 2020 by academics involved in teaching and research institutions. ICPS, the Institute of Child Protection Studies, where I'm from, is one of the inaugural members. And the Alliance is dedicated to promoting the common goal of safeguarding, as well as promoting knowledge and exchange of ideas worldwide on the prevention of abuse of children, adolescents, and other vulnerable persons. And our own work at ICPS aligns very closely with those aims. We're a nationally recognised centre of excellence in the area of child, youth, and family welfare. Established in 2005, this is now our 20th anniversary year, and it was a partnership between the Australian Catholic University and one of our state child protection departments, the Australian Capital Territory Community Services Directorate. And we have offices in Canberra and Melbourne and across Australia. Our research focuses on the safety and wellbeing of children and young people, and it's central to our work. Understanding their experiences and providing them opportunities to inform our work helps us to create evidence-informed solutions for services, systems, policies, and practices. And we're committed to serving and strengthening the capacity of families, communities, and workforces to prevent child maltreatment. And so it's a real delight today to be able to present this webinar, thanks to funding from the Porticus Foundation and support from the Global Safeguarding Alliance. And so I'd like to introduce to you our guest speaker tonight, Katharina Wachter. She is a research associate and doctoral candidate at the Institute of Educational Sciences at the University of Hildesheim in Germany. She's also a lecturer at Karlsruhe University of Applied Sciences. Her research focuses on prevention and child protection, health and wellbeing, cultural change and design work in organisations and intervention research. She also examines conditions and determinants of learning processes in education and counselling and in digital education and online counselling. Katharina's current work is centred on developing and implementing preventative programs in daycare settings, aiming to instil a culture of prevention within educational institutions to safeguard children's wellbeing. And we actually had the pleasure of hosting Katharina as a visiting scholar in 2024 at our Melbourne campus. And during that time, she shared her insights from a pilot program that's focused on preventing violence in German childcare centres. The program applies a healthy settings approach developed by the WHO. And in today's presentation, Katharina will focus on findings on how to adopt a public health approach in this pilot program and how it can help prevent harmful behaviour by educators in childcare settings. And of course, this is particularly relevant in countries such as Australia, where we've had our recent ABC, our national television service, had a Four Corners program called Betrayal of Trust that revealed extremely unsettling issues plaguing Australia's childcare sector. And I'm sure for many of you in other countries that you can relate to this. We've seen failures and systemic issues that have led to child abuse, neglect, and maltreatment in childcare settings, and raising important questions about how you can tell if your child's daycare centre is good quality and whether it's safe and promotes safety. So I think today Katharina's research will give us an international perspective on the state of safety in childcare settings and a public health lens on child protection. As Katharina speaks, I welcome you to post any questions or comments in the chat, and we will return to them at the end when Douglas Russell, one of our senior researchers at the Institute of Child Protection Studies and who manages our work for the Global Safeguarding Alliance, will help coordinate this. So now I'm delighted to hand over to you, Katharina, to tell us more about your project. Thank you.
Well, thank you so much for having me. I'm really happy. It's an honor to be part of this gathering, and I'm delighted delighted to have the opportunity to present Mutausbruch. It's a prevention program designed to strengthening safe, respectful relationships in early childhood settings and to foster the healthy development of children. And a warm thanks to you, Daryl, and his wonderful team at the Australian Catholic University and the Global Safeguarding Alliance for this kind invitation and for creating the space for these important conversations. So I'm going to share my screen now, just a second. For you to see the presentation?
Yes, we can see that.
Is it? Okay, perfect. So then I'm going to start. Just a second. So today I'll like to explore a question that should be deeply relevant for us all. How can we prevent harmful educator behavior in early childhood education? And what does it take to truly keep children safe? Rather than focusing on individual misconduct, I share insights from a pilot program in Germany that approaches prevention as a shared responsibility through structures, culture, and daily practices. So let's begin. Before we dive in, let me just give you a brief overview of what you'll be covering today. We'll begin with a look at how safe children currently are in ECEC settings, as based on recent data from Australia. ECEC stands for Early Childhood Education and Care. Then I'll explore what exactly we mean by harmful educator behavior and why it's often more subtle and complex than we might think. And next, we look at the risk factors, both individual and structural, that can increase the likelihood of such behavior. And from there, I'll introduce the public health approach to safeguarding and why we believe it's a promising way forward. And that brings us to the core of the presentation, the prevention program Mutausbruch, who I was part of the development team. And finally, I'll share some of the key challenges and enabling factors for sustainable safeguarding in childcare settings. So let's get started. We start with a simple but important questions. How safe are children in early childhood education and care? And I will present some data from Australia, but we see similar data in European countries. And we have data from the US as well. According to data from Betrayal of Trust Australia's childcare crisis, this is a national investigation aired by Four Corners in March 2025. Over 26,000 serious incidents were reported in early childhood settings in 2024 alone. And that's a 27% increase over 3 years. On average, that means around 72 serious incidents are reported every day across Australia, including injuries, ambulance call-outs, and missing children. More than 3 assaults of physical violence incidents are logged daily in the states of Victoria, New South Wales, and Western Australia. And at least 1 case of sexual assault or serious misconduct is reported every day. And I want you to know that these are only the reported cases. These figures don't tell the whole story, but they are clear signal that we need to take prevention really seriously. When we talk about harmful educator behavior, we mean any form of boundary violation, no matter whether it's active, passive, intentional, or caused by stress. These violations can take many forms, and they range from subtle moments to more obvious misconduct. First, there are actions that override the child's autonomy. For example, picking up a child without asking, or changing a child's clothing while ignoring their protest, or approaching a child from behind to wash their mouth without verbal preparation. Then there's a lack of sensitivity or emotional neglect, like not comforting a crying child or saying, "That's nothing to cry about," when a child tries to express themselves. Another form of verbal abuse is verbal abuse or intimidation that includes yelling, threats, or mocking a child. For instance, saying, "You're always the slow one," in front of others. And finally, there are physical or sexual boundary violations, such as rough handling during care, in severe cases, inappropriate touching. What all of these behaviors have in common is that they leave children feeling unheard, unsafe, powerless, even when the adult didn't mean to cause the harm. That's why prevention also means learning to notice the small moments and reflecting on the impact our actions have from the child's perspective. What are the risk factors for harmful educated behavior? To understand harmful educated behavior, we have to look beyond individual actions and ask what makes harmful behavior more likely to occur. And we see individual risk factors, but we also see structural risk factors. On the one hand, the individual risk factors are some educators might bring unresolved trauma into their work. And without support, this can shape how they respond to children's emotions. Others may struggle with self-regulation or reflection, especially under pressure, which makes it harder to pause, self-correct, or recognize when a boundary is being crossed. And many simply haven't received sufficient training in child's rights, emotional development, or safeguarding. But just as important and sometimes even more powerful are structural factors. In a profit-driven and chronically underfunded system, there's constant pressure to keep things running, even if that means cutting staff, skipping reflection, or accepting poor conditions. Regulatory gaps and weak enforcement also play a role. For example, in some regions, educators under investigation continue to work with children and parents weren't even informed. The workforce challenges are just as real. Low pay, high turnover, and understaffed teams create daily stresses and make it hard to build the kind of trusting relationships that actually protect children. And finally, organizational culture. Without a culture of open feedback and psychological safety, staff stays silent. Many educators told us, "I saw something, but I didn't really feel safe to speak up." And that's why prevention means more than training individuals. It means changing the system so that safeguarding isn't just written down in policies, but lived in day-to-day culture of each setting. How do risk factors affect educator behavior? When educators face long-term stress or lack support, it doesn't just affect how they feel, it affects how they show up in their daily work. Emotionally, many experience exhaustion or burnout. Their ability to stay sensitive and respond to children's needs decreases. And what we often see is increased irritability, frustration, and in some cases, even negative reactions towards children. Especially intense or overwhelming moments. On a relational level, this makes it harder to build secure, supportive relationships. Instead of de-escalating conflict, stress may also lead to short-tempered reactions. Some educators withdraw, not because they don't care, but because they're emotionally overwhelmed. And these effects don't stop with individuals. In many teams, we see high absenteeism and constant turnover and a loss of team trust. A poor team climate makes it even harder to reflect, ask for help, or notice problems early. And this puts both staff and children at risk. That's why prevention can't be reduced to just train the educator. We have to address the emotional, relational, and organizational dynamics that shape everyday behavior. And what are the effects of harmful educated behavior on children? There are emotional and behavioral impacts. There can be emotional regulation development risks, long-term psychological trauma, and attachment and relational damage. For children, it often starts with the emotional impacts. Shame when they're mocked, fear when they're touched without asking, or sadness when they're ignored in distress. Over time, many children withdraw. They become passive, less creative, more cautious. Others show the opposite, externalizing behaviors like frustration, aggression, constantly testing of boundaries, often as a form of protest or self-protection. Harmful interconnections also affect children's development and regulation. They struggle to build trusting relationships with adults because they have learned you cannot count on grown-ups. Instead of calming down conflicts, they may escalate faster or shut down emotionally, withdrawing from contact altogether. If these patterns continue, the effects can go much deeper. Some children develop chronic emotional trauma, depressive symptoms, or even signs of complex PTSD, post-traumatic stress disorder, especially if the harmful behavior is repeated and systemic. And finally, their capacity for attachment is affected. They may develop insecure, disorganized attachment styles and later have difficulty forming stable, trusting relationships. We have to see that some of the children are more than 10 hours every day in one of these settings. That's why early educated behavior matters, not just in extreme classes, but in small everyday moments that shape how a child sees themselves and the adults around them. We look at the consequences of harmful educated behavior can have on children, from shame, anxiety, withdrawal to long-term relational trauma. It becomes clear this is not just an individual issue, and it's not something we can solve with a few training sessions. We need a broader perspective, a system lens. And this is where the idea of a public health approach comes in. In the public health field, we don't just treat individuals. We create environments that reduce risks and promote well-being at the population level. And early childhood education and care settings are exactly such environments. So the question is, how can we apply this thinking in early childhood education and care? The World Health Organization, WHO Healthy Settings Approach, gives us a useful framework. It reminds us that health is not just created in clinics, it is created in and lived in the settings of everyday life. So if you want to make early childhood settings safe and healthy for children and educators, we need to focus on contextual and structural factors. Not just behavior, but the conditions that shape and enable behavior. When we look at the childcare centers as settings, we use organizational development as a way to embed violence prevention into everyday structures leadership, team routines, onboarding, and reflection. And we rely on, on participatory processes, because change is only sustainable when it includes everyone: management, staff, families, and children. So it's not just about preventing harm, it's about building a culture that protects and supports well-being every day. Now let's look more closely at the ECE setting. Before we dive deeper, let's briefly look at the graphic. At the center, we see the children whose well-being is directly shaped by the ECEC setting. The arrows show the main directions of influence between the different actors. The colored areas represent the macro, meso, and micro levels, highlighting how children's well-being is affected not only by direct relationships, but also by broader organizational and societal structures. So a sensitive and responsive educator-care interaction is essential for healthy child development. However, the quality of the educator-child relationship, and thus children's well-being, is shaped by many interconnected layers in the settings approach. Successful health promotion recognizes that all three levels, macro, meso, and micro, are crucial for both individuals and collective health. These levels constantly influence one another and must be addressed together. Health opportunities and risks are closely tied to the broader societal, political, economical, and technological conditions in which settings operate. Let's look at these layers more closely. At the macro level, broader legislative frameworks and funding policies matter deeply. How government funding is allocated and how regulations are enforced directly affects how providers can design and run their services. When funding mechanisms prioritizes profit, efficiency, or cost-cutting over quality, they send a powerful message down through the system. Leadership within these centers might shift from focus from child well-being to financial targets, compliance numbers, and occupancy rates. And the pressure inevitably trickles down to the team. Educators are pushed towards efficiency-driven practices at the expense of meaningful relationships. Yet relationship work cannot be economized. When caring becomes mechanized, relational quality suffers. For example, we saw children being changed one after another according to a strict schedule without regard to their individual needs. Children are all put to sleep and woken up according to strict schedules, ignoring their natural sleep rhythms. Meal times are rushed into strict time slots, missing chances for emotional connection. Each of these efficient routines often includes boundary violations, and each moment of emotional disconnection accumulates harm. Look at the meso level, the organization culture within centers also plays a key role. If efficiency and appearance are prioritized over transparency, open communication with families suffer. Educators may hesitate to report concerns or mistakes. Incidents might be hidden instead of addressed. Early signs of development difficulties in children may be overlooked or ignored. At the micro level, the daily interactions between educators, children, and families are where experiences are most directly felt, and where emotional security or insecurity is created. Finally, community organizations, local associations, and governmental structures feed back into the system by influencing how policies are shaped and applied, completing the circle of systemic impact around the child. So in short, children are nested within a dynamic, multi-level system. every layer from macro level policies to micro level daily practices has the power either to protect or to harm the child's safety, well-being, and development. Now I'd like to introduce the program I've had the chance to help develop, test, and evaluate. The prevention program Mutausbruch, which translates something like act of courage, supports children's childcare centers in creating safe, respectful relationships and helps educators to recognize and prevent harmful behavior. Mutausbruch is designed to help centers to prevent harmful educator behavior, not just by raising awareness, but also by addressing the conditions that make prevention possible. And it does this through 4 key goals. First, we address the full range of risk factors, not just individual behavior, but also structural, cultural conditions that can enable harm. This means looking after staffing levels, team culture, pressure, feedback norms, time pressure, feedback norms, everything that makes it harder or easier to work sensitively. We are not asking educators to just try harder. We are supporting to build safer environments that support better behavior. Second, we take existing safeguarding concepts, which often exist only as documents, and translate them into practice. That includes, for example, the empowerment of children, team routines that make reflection normal, and tools that bring the code of conduct to everyday conversations. Third, we focus on fostering a mindful team culture. Educators learn to notice micro violations, small, often overlooked behaviors that can still undermine a child's dignity. Because when these become normalized, we all start to desensitize. Over time, that creates blind spots, especially under stress. The risk crossing a line increases. And fourth, we help teams strengthening the ability to recognize signs and harmful dynamics, including grooming. When a team is reflective, emotionally aware, and able to speak openly, it becomes much harder for problematic patterns to go unnoticed. So the sooner we notice, the sooner we act. In short, Mutausbruch isn't just about preventing harm, it's about creating a culture where protection, participation, and trust are part of daily life. So how was the program developed? The program was funded by the Association of Private Health Insurers in Germany and coordinated by the National Association of Child Safety. And it was developed in cooperation with several German universities. It began as a pilot phase with 22 children, 25 in the beginning, and in the end, 22 childcare centers from the South, East and Central Germany, rural and urban, public and private. And the goal wasn't to roll out a fixed model, but to develop the program iteratively and in close cooperation with the centers themselves. That's why the process included regular feedback loops and was guided by a developmental and formative evaluation. Each participating center committed to the program for at least 1 year, which gave us the time to explore what works, what needs to change, and what's realistic in practice. All of this laid the foundation for the next step. In 2026, the program will enter a new test phase, this time with a summative evaluation to assess outcomes and long-term effects. Now we'll get into the core interventions. The program uses 7 interconnected interventions to strengthen violence prevention at all levels of the childcare setting. At the core is the organizational development. Each center starts with an assessment to understand existing structures, routines, blind spots. Based on this, tailored interventions are designed to embed safeguarding into daily practice, which can include leadership, training, and coaching. It means strengthening pedagogical leadership and psychological safety. Through group seminars and individual coaching, leaders develop the skills to foster a culture of participation, feedback, and responsibility. Then we had educator training, which focused on sensitive, responsive interaction. It combines knowledge about children's rights with everyday tools to prevent harm and reflect on professional behavior. Then we had team development, which builds a reflective, supportive culture. Teams learn how to talk about mistakes, give feedback, and handle stress, all essential for safe relational practice. Another part was the child empowerment, to ensure children know their rights and feel confident to speak up. In one activity, for example, children use cameras to document spaces where they feel safe or uncomfortable in the childcare setting. And this shaped changes in room design and daily routines. Then we had family involvement, which is essential. Families are diverse, and so are their perspectives. Our program used surveys, events, and regular updates to ensure transparency and shared understanding. And finally, we worked with on collaboration with the providers, because they play a critical role in creating structural conditions for prevention, from staffing to quality to assurance. During the development phase of the program, one thing became clear. Even though all centers operate under the same legal and societal framework, their understanding and implementation of violence prevention varied widely, and they reflected different levels of prevention culture. And I will now show you a model that we developed through our observations, which also helped us to see how much support is needed. At the lowest level, indifferent, a center may have a written safeguarding policy, but it's unknown to most staff and not part of daily practice. In reactive settings, prevention only happens in response to incidents. Compliance-focused centers follow rules formally, but often without any deep conviction. In mindful teams, prevention is part of everyday practice, driven by professional values and sensitivity. And in preventative centers, safeguarding and participation are fully embedded in daily routines and team culture, and there's a learning culture that continues to learn. Before any process starts, we conducted an organizational assessment to determine the center's current level. Based on that, we designed a tailored support structure. Centers at level 1 and 2, indifferent or reactive, needed intensive multiple level support. Compliance-focused centers benefit from hybrid formats, and mindful teams may only need digital tools and leadership coaching because their foundation is already strong. Leaders can also, when the culture is good, leaders can drive the organizational development process with little support. So I will now tell you what were on the different levels we had, what were the challenges and the enablers we saw. And one key challenge we saw was that on the organizational level was that Even well-trained and knowledgeable educators continued harmful behaviors because the institutional culture didn't support reflection, feedback, or change. And because behavior is deeply rooted in daily routines and habits. Real safeguarding requires more than knowledge of rules. It needs to be embedded in routines. It requires cultural transformation. We have to work with the reality of the way we do things around here. This is how Andrew Hawkins, an Australian sociologist, defined culture, the way we do things around here. In many centers, safeguarding was treated as a formal requirement. The concept existed, but they were often filed away, not integrated into practice. They were used as window dressing. Compliance became performance, sometimes and like window dressing, and didn't actually improve day-to-day pedagogical behavior. This is why we say real safeguarding goes beyond policies and training. It has to be lived in routines, in values, in norms of each organization. And finally, one size fits all doesn't work. Centers are incredibly diverse, not only on their prevention level, but also in size, urban or rural, public, private, different team structures, leaderships, resources, children with different needs. And so one standardized approach often fails to address those realities. And that's where the system itself becomes a barrier to change. And what are the enablers on the organizational level? What helped, what made a difference? First, centers that moved forward didn't rely on static policies. They developed dynamic safeguarding systems. One example we had in Brandenburg, they introduced an emergency response system for staff shortages, including flexible closure planning and shared responsibility with parents. The structure didn't just protect the children, but also protect the educators from working under unsafe conditions, which would affect, of course, how they would treat children, because it would be stressful. And second, centers develop professional guidelines and practical codes of conduct for everyday practice, not just abstract values, but clear arrangements. Like in a team setting, they would evaluate, how do we want to talk to children when they're upset? How do we want to support each other in difficult moments? And these codes gave teams something to hold on to, but they, in a participatory process, they developed it themselves. It was not given from the provider. Third, human resource development was key. Some providers introduced structured onboarding processes. New staff didn't just learn where their where the risk factors are, but how the team works, what the safeguarding principles are, how feedback happens. And finally, and maybe most important, psychological safety. In teams where people felt safe to speak up, to admit mistakes, to challenge something, that's where real change, real learning became possible. Because mistakes happen every day. One team described how their entire safeguarding culture shifted after their team introduced regular reflections. They said we stopped avoiding difficult topics, and that was when we really began to change. Before that, were in automatic processes. So let's look at the leadership level, and the challenges we found here. In some centers, leaders focused mainly on administrative tasks, on compliance with external standards, or on managing costs, but not on shaping professional culture. And where that happened, team spirits and clarity around safeguarding suffered. What we also saw was a lack of visible, active leadership. Leaders stayed in the office, not in a team. And when leadership disappears from the team space or the daily pedagogical practices, teams often became fragmented, stressed, and unclear about responsibilities, especially in times of stress. And many leaders we worked with were incredibly committed, but at the beginning, they had little understanding of psychological safety. Psychological safety means that people feel safe to speak up, to ask questions, to admit mistakes, and to raise concerns without fear of being blamed, punished, or judged. They didn't know how to create a space where teams could talk about mistakes, about fear, or give each other honest feedback. One leader told me at first, constantly talking about mistakes felt really uncomfortable, and I thought it was not helpful. But over time, it became kind of normal. Everybody did it. And once it was normal, we saw how much we learned and how much, and somehow how much stronger our connections are now. But getting through that first phase was the hardest part, she said. And finally, another important pattern we found: how leaders treated their teams influenced how educators treated children. In centers where leaders were critical or unavailable or reactive, we often saw the same behavior patterns mirrored in the team's work with children, especially under pressure. Leadership culture flows down to the pedagogical culture, and where leadership is weak or misaligned, safeguarding suffers. Then what are the enablers on the team level? What helped, what supported effective leadership? Strong leaders were visible, approachable, and open. They were present in the team, not just in the office. They listened, they responded, and they didn't shy away from addressing issues. These leaders are actively held their teams accountable, but in a way that builds trust. They modeled respectful behavior, and they protected time for reflective conversations. In centers where leaders were visible, accessible, and led by example in everyday pedagogical practice, teams tended to perform more reflectively, and more mindfully. One small center had reached an impressive level of safeguarding practice, almost at what we could call a mindful level of prevention according to the levels. But when the director had to leave unexpectedly due to illness, within weeks, the system collapsed. The team fell back into reactive behavior, reflection routine stopped. Decisions were made for compliance, not for children. This was a powerful reminder that leadership is not just about structure or authority. It's about continuity, presence, and relational trust. Second, they led in a participatory way. That means involving the team in decision-making, not just informing them, but shaping goals together. In one center, the leadership team started every staff meeting with the question, what's one thing we are proud of this week? And one thing we want to understand better. And this simple structure gave the staff a voice and created ownership. And third, the leadership training and coaching was the one intervention that was rated most useful. Most leaders appreciated that they had new insights about the opportunity, but also the opportunity to receive individual coaching for their specific needs. Leaders learn to create psychological safety, to give and receive feedback, and to structure team processes in a way that supported learning. On the team level, the challenges were closely linked to what we've already heard, but here they become visible in the everyday dynamic between colleagues. In several teams, psychological safety was missing. People held back concerns, avoided giving feedback, and felt unsure about speaking up. And this created a culture of silence, not out of disinterest, but out of fear. Without safe routines for reflection, stress built up and small issues often escalated. What was missing wasn't just knowledge, but the space, trust, and shared responsibility in the team. And what happened at the team level was quite simple but powerful. What were the enablers? Teams that regularly reflected and gave each other feedback reduced the fear and strengthened trust. Psychological safety made it possible to talk honestly, support another, and take shared responsibility. And when teams had routines for reflection, even just 10 minutes a week, it helped them to foster a preventative culture. On the educator level, the individual level, we saw what professional knowledge alone wasn't enough. Many educators struggled to regulate stress, especially in moments of conflict or overload, that made it hard to stay emotionally available for children. At the same time, there was often pressure to get it right at the time. Fear of making mistakes led to shut down or avoid difficult situations instead of learning from them. And in some cases, personal history or unresolved experience influences how educators reacted, especially under pressure. So supporting safe practices means not just training skills, but also supporting self-reflection, stress regulation, and emotional resilience. At educator level, we saw was helpful was not, we saw that helped most was not just training, but reflection, connection, care. And many educators told us that learning just to recognize their own stress triggers and was just as important, though, than learning their stress triggers from their colleagues. That made a huge difference. One educator said, "What really changed things was knowing what sets me off and what sets off my colleague. Now I notice before she reacts, before she reaches her limit, and I can remind her to take a step back. It feels comforting to know we look for each other. She watches over me and I do the same for her, and we help each other through." It was about mutual regulation, not just self-regulation. Self-care, mindfulness, and peer support helped educators to stay emotionally present and responsive. And when mistakes happened, teams that used restorative approaches, not blame, created space for recovery, learning, and growth. One of the biggest challenges is that many children simply don't know what their rights are. So when we look at children and family challenges, or children don't know what counts as a boundary violation. And even if they do know it, they often haven't had the chance to practice speaking up, especially in situations where adults are involved. At the same time, some parents are unaware of what safeguarding actually means in practice. And that creates tension, especially when children are encouraged to speak up about adult behavior. What made a real difference, what in children and families, where us empowering children with clear age-appropriate knowledge, not just what their rights are, but how to recognize unsafe behavior and what to do if something doesn't feel right. This way, children knew that what respectful adult behavior looks like, and were also able to recognize it and talk about it, even when adults, and even hold adults accountable. In several centers, we translated simple professional codes of conduct into simple visual posters for children so that appropriate behavior became visible and understandable for them. At first, one group of leaders told me that she didn't want the poster. She said, "This is total transparency. This is way too much." But we brought the idea into the team and discussed it openly. And in the end, the team decided to go ahead with the child-friendly visuals. And interestingly, a few weeks later, the same leader said she was actually glad she had done it. It made us more consistent, and the kids really engaged with it, she told me. Also, it's absolutely crucial to inform parents about the program, about what children were learning, about what why speaking up matters, even when it's uncomfortable. That's when safeguarding becomes a shared effort. In another kindergarten, the team transitioned from a closed group model to an open concept with team learning spaces to strengthen children's participation and voice. But the responses from families were mixed. Some parents strongly opposed the change and even moved their child to different centers. Others said things like, "I don't want my child to tell me how to talk to them." And this showed us how crucial it is to bring families along, to explain why we are doing that and what we are doing and how it benefits the child. So empowerment doesn't work against parents, it works best with them. To end, I'd like to share what I believe is at the heart of this work. Policies and safeguarding frameworks are absolutely essential. They lay the structural groundwork for protecting children and supporting healthy development. But policies alone don't automatically translate into safe, respectful daily practices. For that, we need change on all levels, from national frameworks to team routines. We need a preventative safeguarding culture, a culture that makes it easier to act mindfully and harder to look away. That means educators need support, not pressure. Teams need time for reflection. Leadership needs to model safety and care. And yes, policymakers must set the structural conditions that make real safeguarding possible by ensuring adequate funding and by limiting profit-driven models in early education. Because this is more than a technical task. It's an ethical responsibility from my point of view to protect children and to create the condition for a healthy childhood. The children of today shape the society of tomorrow. And that's what Mutausbruch stands for, standing strong together. And that's what prevention needs. It's not isolated effort, but shared responsibility. So thank you for your attention and for your commitment to the rights and safety for children.
Thank you so much, Katharina. That was a wonderful presentation, and to see all of the different developments and to hear about the challenges that you faced in setting up those programs is just wonderful. I can see some comments about how closely the program and its key concepts align with the national principles and child safe standards we have in Australia. So hopefully, I can see that and know that we have people subscribed to the Global Safeguarding Alliance, and it is a global safeguarding alliance. So hopefully all of that comes together to help us globally, as you said, make a better future for children and for our societies. I can see some congratulations coming in from people mentioning where they're from and the importance of helping leadership and so forth. We do have 5 minutes left to field any questions, and one has been put in the chat directly to me. It's a great question. You mentioned the sort of iterative process that you used. I don't know if you would call it co-design. That's the term we're using in Australia. Maybe it's a bit different. But the question was, were children involved in this iterative process of learning what kinds of safeguarding skills are needed?
So that was a really delicate thing to involve children. And we talked a lot about that before we did it, because for us, it was important when children are involved that children also see that there was something changing. They needed to see that, because if we ask them about their educators, they really have to feel the impact. So what we didn't involve them in the process in the beginning as in the assessment, but during the time when when the children got used to us being there, seeing us, when were not strangers to them anymore, we involved them with games like that photo safari I told you about, where they had cameras walking around in the childcare center and making photos of areas they felt safe and unsafe. And then we put that into the team development process, into the organizational development process, where really real change happened. Yeah, but it's a delicate thing. And I think the most important thing is that children also, when they are asked about delicate things, they need to see that things are changing and that we are accountable and respectful with what they say. Yeah.
Yeah, definitely. As you're saying these things, we make it very clear in parenting situations. If you say that there's going to be a consequence to your child in relation to their behavior, you have to follow through with that. Otherwise, that child might start thinking, well, I can do whatever I want because I know you're not going to follow through with those consequences of not giving me the ice cream after dinner and things like that. And I think the flip side of that is true. So whilst it's important that children know that we'll follow through with maybe things that are conceived as negative to them, if that we'll follow through with those or we won't, they need to also see that we're going to follow through with the things that are positive in their life. So if we say we're going to do something that's going to make their lives better, they need to see that. And as you said, it can be a more delicate or difficult thing to do with younger children because they don't have that cognitive development yet that older primary school children like I taught earlier in my previous career or young people at the secondary school level might have. We've got a couple more minutes. Is there anyone that's got a question they'd like to ask Katharina themselves? Please feel free to raise your hand. I can see a question here.
Shima's got a really good question about how it was that leaders opted into this project, Katharina. What did it take to get them on board?
So actually, it was as it was a pilot project. We most of the time the providers actually came to us, so it was open, and they could apply for. And it was through not through the leaders. Most of the time, it was through the providers. Yeah, but this is an interesting question because it was also not so clear. Sometimes when the provider said, we want you to do that, the leader was not really in the boat at the beginning. And it was in some centers, it was really important that we had this coaching at the beginning. And there's another thing I didn't mention, but it's really important because what we are doing, we are actually in a sense, we are attacking the professional identity of educators and leaders in a sense. So we are saying your work that you did before can be harmful, and this is also something that is something you have to consider. And that's why it really helped to start with stress prevention, because then you go into the boat and say, okay, we see you have stress. We see your need. And through this stress prevention program, they realize, okay, that's true. And in my stress, when I'm triggered, I really react harmful sometimes. So this was really a good way to get in to that process.
Great. Thank you so much for that. We have had a couple more questions come in, so we'll just field those two. One of them is from Jacqueline saying, wondering how or if you've recorded or reflected on the micro violations that you spoke about, and if so, what did they teach the staff?
Excuse me, can you say it again? There was
Yeah,
some.
sure. Wondering how or if you recorded and reflected on the micro violations that you spoke about, and if so, what did they
Yes.
teach the staff?
Yeah. So the micro violations were, and that was also really. I was a little shocked about it that I would, as an observer, see so many violations because I was there observing violations. And we saw people changing diapers, and the child was crying, and the person wasn't responding adequately to that child, and things like this, or not leaving a child crying. And these micro violations we saw. And of course, in the team development process, we brought that in. When we started to do we had one team development process with what about feedback and how to give good feedback, and exactly in these terms we brought that up. We talked about it, and they learned how to talk about micro violations through that process. They were trained in also communication skills. Yeah.
Fantastic. Well, look, it is just past the hour for wherever each of us individually is. So once again, on behalf of the Global Safeguarding Alliance and us here at the Institute of Child Protection Studies at Australian Catholic University, Katharina, we would like to say thank you so much for your presentation. It's wonderful work. And we ourselves, we're starting to move into the space of early childhood here at ACU, and we're really looking forward to working alongside you in supporting the safety of young children in their early childhood years and those formative development years. So thank you once again so much for your time. Thank you to everyone for coming along. Keep an eye out for the newsletter, and please do feel free to forward the newsletter and also the link to subscribe to your colleagues within your networks, post it on social media. We're looking to continue to have as many people access all of this important information. So thank you again, Katharina, and good morning, good afternoon, good night to everyone. Thank you. See you.
Thank you.
We finished the recording, Moran.